from University Technology Mara. I graduated on May 2017. And before I started my PRP on 15th of January 2018 at Hospital Kuala Lumpur, I worked in a retail pharmacy as a retail assistant for about 6 months. And then when I started my PRP, of course, we had to go through a lot of training, especially if you're in a hospital, then you have to, especially me being in Hospital Kuala Lumpur, we have so many different facilities. So we had to be very specific into specific departments. So yeah, it was a hard training for me, but it's my choice. So yeah, and then after a year, I completed my PRP and I received my certificate, my FRP certificate. And at that time, I was after we finished our PRP. For those, for those who didn't know, because I saw some of the participants are actually a student, I will try to explain briefly. Like after you finish your PRP in a certain place, and you receive your FRP certificate, you won't actually be in the same facility, or you can be in the same facility to actually continue your compulsory service lah. So for my case, after I receive my FRP certificate, I have to be in a position that we call as floater. We will be in a department for about probably the maximum you can go is up to 6 months, I think. But I float for about 3 months, and then I got transferred out to KK Setapak to complete my compulsory service lah. So for those who didn't know also, like the contract now is actually 2 years of PRP, including PRP and compulsory service, 1+1, and also another year of contract if you are not selected to be as a permanent staff lah. So about a year in KK Setapak, I learned a lot as an FRP, and sadly on 9th of January 2020, I did not get to be absorbed as permanent staff in KKM. Yeah, and then I continued my second contract on 15th of January 2020, and at that point of time, I started actively looking for a job because I only have like less than a year to actually find a job. And when I decided to move out from KKM, I resigned. I resigned on 31st of November 2020. And for those who didn't know also, the first contract, the 2 years contract, you cannot actually resign. If you resign, you need to pay some amount. But for the second contract, you can actually resign at any time. They won't penalize you or put any payment if you leave the government. Okay. So next is I would share my experience lah as a job seeker. So I put it down to these 5 points. So when did I start looking for a job? I started on December 2018. That's quite early because I think on December 2018, I haven't finished my PRP yet. But I started doing stuff lah, looking for a job, like updating my resume and stuff because it's something that you cannot sure lah what will happen in the future. So I started quite early, but I aggressively started looking for a job after my second contract lah. Okay. Yeah, why? Because of the contract, of course. Like it's a 2 years plus 1 year contract basis, so it's not that long and it's not very convincing for me to actually to be in a service which is a contract basis, contract service. So yeah, better safe than sorry lah. That's why I started quite early lah. Okay. So what platform did I use? Of course, if you are a job hunter, you should know this lah. Like you need to have a JobStreet account, a LinkedIn account, and some social media such as Facebook also provide you some job vacancy in certain pages and groups. Well, for my case, I get my job from Twitter. It's a funny story because I tweeted this description about myself and what I'm looking for, and suddenly someone replied to that tweet. And yeah, I get what I get my current job because of Twitter lah. So thank you to all the people who retweets my tweet lah. Okay. The fourth point, okay, how I actually prepare myself is basically I update all my resume and CV lah. So I think after you finish your degree, right, you should have your resume already lah. You should have your resume and you should update, at least update it monthly or yearly, depends on how often you've seeking for a job lah. But you need to have your resume like right after the degree, I think. And also a cover letter would be nice. If you are looking for a specific job, you can attach a cover letter with a resume also, protruding to that specific job lah. Okay. Yeah, interview practice also helps. If you can Google some general questions regarding interview, you can actually practice on how to be quick when answering questions lah. Because some interviewer don't like that long pauses kind of answer. Yeah, maybe you can actually have a practice for your interview first lah. And also if you had gone a lot of interviews, also is considered as a practice also. And also you need to know what you want lah, what kind of job, what kind of terms, what kind of salary and everything. You need to know, you need to put that in your mind first. And when the interview give you their terms, you need to also give your terms also lah. You need to really know what you want lah. Okay. So to which pharmacy setting I go to these four main pharmacy setting lah. Yeah, I started with clinical setting because I'm from a clinical setting. So it's also in my comfort zone. So I tried very hard to actually get myself to clinical setting, but sadly I didn't get into. And then I tried retail, some retail pharmacy, academia. Yeah, I had been interviewed to be a lecturer in one of private university to teach diploma students, and also wholesale. Yeah. So basically this is my experience lah as a job seeker and some of my opinions on it lah. All right. So next I'll move on to skills that I think most recruiters are looking for. So I put these 3 points because I find that these 3 points is actually useful for you guys, especially when attending an interview. Okay, I'll start with the first one. A is adaptability. Yeah, you need to adapt to a certain environment or new environment or condition very quickly because I think this is what most recruiters are looking for. If you get to adapt to some new condition and new job and everything, then of course they will see you as more confident in doing your job. Okay, so how do you actually do this? Is basically you can ask anyone, ask your colleagues, ask your boss if you are lost, or during an interview, right? If you don't feel very confident in certain terms or issues, then you can ask directly during the interview, because that just put away a lot of this mind-boggling thing inside your heads also. And this also will show that you are proactive also. If you ask a lot, if you being proactive, and it can make you very adapt to the situation also very quickly. Okay. So my second point is self-esteem. Of course, we need to have a high confidence level when doing an interview or being in a new job, of course. So how do we do this? You have to be very communicative, of course, like during an interview or during working in a new job. Yeah, you have to be very communicative. And then you have to be very transparent. Being transparent means that you need to make sure that the interviewer knows what you want, know what's your terms, know what everything that you want. Don't fabricate yourself lah. Don't do things like when they set their terms and you just accept, because is bad. In a way, it will affect your future. So if the terms that is set by the interviewer or any company is not up to your par, then you have to learn how to say no lah. You need to say no and why and everything. Yeah. And that shows that you are very confident that you can bring yourself up lah. Okay. The third point is knowledge. Of course, knowledge is very important, not just being very smart and intelligent and having high CGPA and stuff. Is actually able to find the knowledge from the right sources. So me being a clinical pharmacist back then in my clinic and my hospital, I don't have any knowledge on distribution part of pharmacy, especially in industrial pharmacy. So when the interview asked me like how can I actually do this job if I don't have any experience on it, so I told them that if you have the right sources, you can actually learn from it. So it's about you willing to learn and getting the knowledge. It's just not about you being smart and intelligent and having the highest CGPA and stuff. There's nothing to do with that lah. Okay. And also you need to know about the industry that you apply for. Of course, you need to have a bit of knowledge on what kind of job, what kind of pharmacy setting that you are applying for. At least know a little bit about the company. So when the interviewer asks, you don't have this long pauses, like this don't know kind of answer. Yeah, just read a bit about the pharmacy setting and the company that you are applying for lah. Okay, so yeah. Move on to the next point is my personal tips and advices to all of you. And I think these are the most tips and advices that I can give to you lah. Okay, this is what I've been through lah. So the first one is mental preparation. Yeah, you need to put in your mind, like if you are in the contract service in government, you need to know that there is an uncertainties of the future lah. Of course, you cannot be sure like you can get permanent. You can be absorbed as permanent staff in KKM. You cannot be sure. So you need to put that in mind, and then you need to actually what do we call that? You need to actually figure out what to do because you don't have that answer, because the future is not certain. So this is why you need to actually learn the process of job hunting straight away after you you are in the contract service. And then also you need to learn about different alternative of pharmacy. So don't stick to one pharmacy setting. Okay. The second one is financial preparation. Yeah, this is quite true for me, and I think for some of my friends also, because when you are offered to work with the government, of course the salary is quite high for some people, and then you have to be very in Malay we call it boros. Okay, we tend to be very boros and spending your money, and then having big financial commitments such as having expensive cars, like having credit cards, personal loan, and even I think to be honest, that marriage also is a big financial commitment, because when you are married, you need a house of your own, you need to support your family, and then you're probably expecting a child. So yeah, this is something quite serious also lah. So I think save adequately if you are working with the government currently, because you are not sure what will happen in your future also. Expectation, yeah, you need to expect that there are a lot of market of pharmacy outside there beside clinical settings. So if you are in a service with the government currently, of course you are doing clinical stuff lah. But there are a lot of market out there, lot of different market of pharmacy out there. So try lah. You just try something different and new, because I think if you don't try, you don't actually know what is actually the job punya description and everything. Yeah. I think you just need to try, and you need to expect this also. Macam you cannot be in your comfort zone for a very long period of time. Okay, so you need to go out of that bubble and then actually try something different lah. Okay, rejection. Okay, along the way, from doing this interview and also applying for a job, I never had a formal rejection letter. Because they also don't have time for you, like to actually write a letter to you and okay, you are not suitable for this job and everything. No. What I get the most is ghosting, like in relationship, in Tinder, you are ghosted always. So yeah, I only got that lah. Or probably after an interview, they will tell you, okay, in a week, if you don't get any reply from us, then you probably don't get the job. So it's something like that only. No rejection letter, no anything lah. So yeah, of course, I've been rejected a lot of time also. And I think I refused a lot of jobs also due to some terms and condition that I am not agreeing with them. Yeah. And how do I cope with rejection? Yeah, you need to have a very good support system. Okay, I do this with my family and my friends. I told them everything. I told them everything that what job I'm applying, like what is the job description and everything. And if I didn't get the job, I will tell them also, and I will tell them that how do I feel now and whatever. You need to have a very good support system to actually help your mental state especially. Okay, and please be in mind that when you don't get a specific job that you want, that is probably not 100% your fault. Don't make it hard on yourself lah. It's probably that they cannot actually afford to hire you, or probably they cannot agree to whatever terms that you put to them, or probably it's just they have different options for you. Yeah, there could be a lot of possibilities lah. Macam don't put something that is don't put this as a big problem. Okay, and also you need to give you need to give yourself sometimes lah to move on. Okay, if you have been you've been rejected to something that you really want, and then you need to give yourself sometimes to move on. And how to do this is basically how you release your stress lah. Okay, go out with your friends. Okay, not now lah, like this PKP. I mean, like you have to do something to release your stress lah. Okay, eat ice cream, eat chocolate, I don't know, like do something. And it also takes time now for you to move on. I mean, in a relationship also, if you break up, you need sometimes to move on, right? So yeah, I think it's the same thing. Just make sure you don't stress about this and don't put this job seeking thing too hard on yourself lah. Okay. I think that's all from me. Thank you for listening. I will pass back to the moderator, Jian Rong, to help to assist me with the Q&A.
Sure. Thank you for your sharing, Adlisyah. I think before we proceed any further, right, just want to check with you if you could also share with us a little bit about your current job, because I think our participants would be very interested to know what you're currently working as, the details and whatnot. Yeah, would it be okay for you?
All right, sure. Let me remove my screen first. Okay. Currently, I am working as a wholesale pharmacist in a company located in Shah Alam. So basically what I'm doing now is basically my company started with zero. We don't have any pharmacists when I started working there. So I sort of like single-handedly did everything in my company. So I started applying for licenses. I do all the SOPs and everything for the distributing part. So now we are a licensed wholesaler, so we can actually sell medication to clinics and pharmacies only, because we are business to business kind of pharmacy. So we don't sell to end user lah. So, but in future, probably we'll open up a retail. Yeah, probably somewhere in the future. So basically that's what I've been doing also. And we also currently doing a lot of project on medical device too. If you guys read on yesterday's news, the first Malaysia rapid test kit for self-use is from our company also. So do support.
Interesting to know about that. I think one of the questions that I had in mind after listening to your sharing is like, because you're sharing about your experience quite a vast experience, I would say, and also very different from one another per se. Because I think you start off with clinical settings, right? PRP, FRP, then subsequently you jump to retail and to academy, and lastly, you're currently at the wholesaler or distribution part. So just want to know, like, what actually shaped your career choices, seeing that they are quite different from one another? Like, what made you to come up with a decision to join the wholesaler part?
Okay. To be very honest, is the time. The time, because time is like a ticking bomb. It was in August or July when I get the offer to my current job, and my contract ended next year on January. So I really didn't have any much time to actually jumping from another job. So I think that time is basically what pushes me to actually go out from my comfort zone. And also the company itself, because they have been such a lovely company to me. They have been a very good colleagues to me also. I think you need to have a good job, a good work environment to actually be to sustain in a company also. Yeah, I think that's the two most thing that actually pushes me to go out from KKL.
Yeah, I would say that because it's quite unpredictable on where we'll
Yes,
eventually end up with, since contract is not really something that for sure
yes,
that we'll
yes,
be able to have a job in KKM.
yes.
So let's say if since this is quite unpredictable and we may eventually join up a setting which is very different from what we're currently practicing, like what kind of transferable skills or advice that you would advise our let's say our participants to actually equip themselves with, or what kind of preparation they should do before they fulfill their contract in the KKM setting?
Okay, like this. I think to prep your knowledge is basically important. And then you cannot put yourself in this small bubble where you are going to work in KKM and being a pharmacy that is in a clinical setting. You should explore more on the market outside. And regarding the skills, I think I think like the most skill that you need to have is to actually being able to speak out and know what you really want. Because if you don't have that, then you actually can be enslaved by some company also. So yeah, you need to actually know what you really, really want and what are your terms. And then being able to speak out when having an interview or a discussion with some interviewer. You really need to know like what you really, really want, and putting yourself out there and being very, very transparent. Yeah.
The case just to be clear with our goals, what we want, and also be outspoken about it. Okay, got
Yes. Yeah.
We actually have two more questions from the floor, so allow me to
Okay.
share them with you. I think the very first one is regarding to the KKM contract. So
Okay.
the question goes, when will we know whether we'll be absorbed into government setting or KKM as permanent staff? Is it at the end of the compulsory services?
Okay. So as I mentioned before, like our KKM contract is 2 years of contract. So a year of PRP training and another year of compulsory service. So yeah, we will know our status, whether we are going to be absorbed as a permanent staff or not. Like 4 weeks or 2 weeks before you are going to end your contract, on your first contract you're ending your compulsory service. Sorry. Yeah. So 2 weeks before or 4 weeks before ending that contract, then only you know whether you are being absorbed or not. Yeah.
Right, so 2 to 4 weeks before or prior to the
2 to 4 weeks before, yeah. But I saw a lot of my juniors, they get it very late lah. A week before also ada, like 5 days before also ada. So yeah, it's very, yeah.
So generally it's between 2 to 4 weeks, but definitely before the confirmation, right?
Yes, true.
Right. Okay, so the next question is actually about one of your experience, because previously you mentioned that you had experience as in academia part, right, as the lecturer for diploma students. So this participant would like to know, what platform can they find the job vacancy as a lecturer? Would you mind sharing on that?
Okay, for this particular job, I don't apply for that job basically this person, he reached out to me in LinkedIn, okay, and then asking me whether I am interested to teach diploma students lah, basically because I think for diploma students, you don't need to have masters to actually teach them. Yeah, so I think that the reason why I reject the job is because the private university looks kind of dodgy and fishy. So but I think there's a lot of private university out there that actually offered tutor position if you have a degree in pharmacy to actually teach diploma and also degree students also. But as a tutor, not a lecturer lah.
So in that case, they should reach out to the universities to understand more instead of
Yes.
through social media.
Yes.
Okay. I guess that would be a useful advice to everyone who is interested. Okay, so due to time interest, we'll proceed with one last question from the floor. The rest of the questions we'll be sharing it with Adlisyah, no worries, and we'll address it accordingly.
All right.
So let's just proceed with the last question. The last question is regarding results. So this participant is curious, how does CGPA plays a main role for pharmacists in finding a job, especially after you have fulfilled your PKM contract?
Okay, regarding this, okay, I graduated in 2017, and previously before that, the contract system haven't started yet, so they took all these pharmacy students for an interview. If you pass the interview, then you get the job as permanent staff lah. But for you to get into that interview, you need to have the highest CGPA, and then only they will call the lowest CGPA one. So back at that time, it is kind of important to have the highest CGPA to be absorbed as permanent staff lah. But as time moving on, they don't really do that anymore. So you can be in KKM service as long you pass your degree lah, as long you pass your degree actually. But I think like CGPA, right? I think it doesn't really reflect who you are lah. I mean, it does look good on your resume and CV, of course. It does look good, and you can put all your honorarity, like what did you get from university. It's such a good thing to have that in my resume, but I didn't have that. But okay, you can actually put something else that probably your experience. I don't know. Try to get a lot of experience. Try to join any community, any pharmacy, any NGOs probably to put in your resume, just to make sure that you are very experienced despite the CGPA. Okay. But if you're asking me whether that thing is important or not, of course it's very important because it looks good in your resume, and people will actually look that first if you're finding certain jobs such as a clinical pharmacist or especially if you want to be in academic line. Of course they will look on that lah. But in generally, CGPA for me, I really don't look at that. I will look that person whether they have the skills that I really want lah. Okay, for me lah, if I'm a recruiter, I don't really look on CGPAs lah, because it doesn't really reflect yourself lah. Like doing jobs is not really coming from what you done in your CGPA, because it's really about like you doing your job and having that skills of doing that job lah. Okay, knowledge is another thing lah.
I think essentially it's more of a baseline requirement, which is equally important.
Yes.
The rest is just depending more on your attitude and also what skills you have.
What skills you have, yeah, true.
Yeah. Okay. Thank you so much for your sharing, Adlisyah.
Yeah, you're welcome.
A couple more questions.
Okay.
But may need your help to respond to the Q&A platform directly, because we're sort of running out of time.
All right, sure.
Thank you so much, Adlisyah, once again, and thank you everyone. So this sums up the 10 minutes of the Q&A session. We'd like to thank everyone again, including Adlisyah, for his sharing. So without further ado, let's just proceed to the next session. So up next, we have our speaker, Ms Winnie. Allow me to introduce her. Okay, so please direct your attention to the screen. Yep, so this is our speaker and her biography. So allow me to introduce briefly on who is Ms Winnie. So she's currently the research officer in Galen Center for Health and Social Policy, KL. So he works as a health policy advocacy think tank. She was a member of Research and Development Committee of Pharmacy Unit in the Health District of Compact from year 2018 to 2019. So she was also the Health Literacy Coordinator and Pharmacy Volunteer at Clinic Amma Muhajir, an initiative to increase healthcare access for refugee and asylum seekers. She is experienced as a pharmacist at Gombak Setia Health Clinic and involved in the Diabetic Medication Therapeutic Adherence Program (DMTAC). She is also a graduate of Monash University, Malaysia, with a Bachelor's of Pharmacy, and she completed her training at Hospital Kuala Lumpur. Right, so I shall pass the floor to Winnie. Winnie, the floor is yours.
Thank you so much, Jian, for that introduction. Just allow me to share my screen. So basically, Adlisyah has said everything that I wanted to say, and it's comforting to hear. I was actually quite, I felt quite comforted hearing how he laid out each step of his journey, starting from when he finished his contract position, and all of the realistic obstacles and kind of considerations that you need to have when you leave the public sector. So thank you, Adlisyah, for that opening act. It is difficult to follow. I have taken the liberty of taking a different approach. So what I'll do is, what I've experienced is similar to Adlisyah's experience. It was a feeling of like trying to find my way in a very uncertain world, right? And I think back in our days, there wasn't a pandemic. So this is an additional factor for the current graduates or for the current young pharmacists in KKM. What I'll do is I'm actually looking backwards. So I'm taking a retrospective look from where I am currently. And I want to highlight to you some of the skills and some of the tips that I would give to myself if I knew it back then. So I hope this is useful. I've also kind of asked a few of my colleagues as well, so that it's not just my experience, but a few people who have gone through a similar journey. I have very far to go to understand health policy, but I do see the value in this discussion, and so I agreed to kind of share a little bit about how you as a young pharmacist can be involved in formulating, implementing, evaluating, and influencing health policy. I think that once you see this as a possibility, it will open up, hopefully it may open up some options for you. So the first question that many of you may have is, what does being a pharmacist have to do with policy? All of you, if you've dispensed even just one prescription, you have played a part in implementing the National Medicines Policy, or what we call DUNAS. So this policy sets out a priority for the government to provide access to medicines for the population. And another example is waiting time, right? So the Ministry of Health, the government, they do not want patients who are sick, who are unwell, to wait for 3-4 hours to pick up their medications at the pharmacy. So that is why all of us in outpatient, we strive to meet the 30-minute waiting time target. But as you very well know, having a policy in place doesn't mean that it's implemented perfectly. And we need other policies, for example, medication safety, making sure that patients get counseling if they have any questions about the many medications that they're getting from us. So you can see that your practice so far, whether it is in clinic kesihatan, whether it's in hospital, it has been embedded in this framework of what the health service as a whole wants to achieve and what it thinks is important to achieve. If we step outside of pharmacy, of the department, you can see that running a health system really depends on having various policies in place. And not just that, these policies have to be responsive and it will change according to need. So for example, now we use a lot of bus because patients are not able to go to hospitals. But in the bigger picture, as health needs and populations, as they change, this will lead to new challenges. For example, we know that our population is aging, and how we do things now may not be very applicable in the future. And more people have chronic diseases, in which case the way that you provide treatment access is actually very different. And you have to consider health promotion to prevent these chronic diseases. How would the health system reduce premature mortality? How would it reduce all these new cases of preventable deaths, preventable diseases? And you may need to you may need to actually have work and school policies to shape the health promotion and prevention environment. And I think another important aspect that stands out to me is social inequalities. And it's not something that we're routinely trained to think about as pharmacists. That's more of like social workers. But I'm sure that you know that this actually affects health to a very large degree. So if you work with a certain population, for example, people with disabilities or migrants, you would not be able to improve their health without considering these factors. Okay, so all that I really want to impart up to this point is that senior officials, people who are sitting in Putrajaya, are not the only ones involved in health policy. And NGOs, academia, and the private sector are very much part of the formulation. They're very much part of the conversation as well. So perhaps these are some options that you can consider. Creating knowledge as a researcher. You could be advocating for change. You could be building capacity as a program manager. As Adlisyah mentioned, it is really important to know what you want. And this is the benefit of going into the private sector, is that you drive your own growth. So there is no, you're not going to get an email saying that this is the time for you to promote yourself to the next grade, for example. And once you have an idea of what you want, you have a bit more control. Initially, I did feel a sense of loss because I've always seen myself working for the public sector. And when I began my new job, where there were no patients in front of me, there were no queue, no prescriptions to process, it was a little hard to adjust to. But I knew what I wanted. So in the long view, and this is kind of like my retrospective reflection for you, is that we cannot imagine all the possibilities until you make a move and then your view actually shifts completely. So if you're here today, you've obviously thought a lot about where you want to go, or at least you're open to thinking about it. Some of you may have gone for a few interviews already. So, please do share and ask questions if you have any. Wherever you are, give yourself a pat on the back. It's not easy to launch yourself into something new. It's not easy to find out that, you didn't get a job when you tried really hard to get it. And so here are some possibly useful tips for the journey. I think the most important thing is always take care of your mental health. So never sacrifice your mental health for something else. And not only think about what value can you add to the organization, think as well about what value can the organization add to you, what you want to do with your life, what you want to do with your career. So if you want financial security, or if you're looking for growth, or if you're looking to work with vulnerable populations, think about what value can this company that you're looking at add to this. When you go for an interview, it sometimes does not correlate, it does not match directly exactly with the job description. So when you go for an interview, you may actually get new information or new insights into what you're actually expected to do. So keep that value in mind, because it will help you to determine whether you really want to continue pursuing this job or not. As mentioned by the previous speaker, do background research. Know what is the mission of this organization. What do they work in? what are the overall goals that they exist? Like, why do they exist? Okay, and it will be really helpful, I think, to follow the leaders or potential mentors in this field. So if you don't know very much about, let's say, HIV, you don't know very much about HIV, but you want to be involved in it because you were involved in RVD, MTAC, and you feel that this is something that you may really want to explore. So follow the Malaysian AIDS Council, follow people who are in this field, who are producing the current statistics and the current progress in this field. And yes, always write thoughtful cover letters, put something personal into it. And when you arrive, when you get the interview and when you're at the interview, show that you can communicate and drive the conversation. So don't just answer and then just leave a silence. If there is a space for you to follow up with a question or follow up with a comment, go ahead and do that, because it shows that you can communicate. And this may not be something that we have experienced in pharmacy interviews. So I think in pharmacy interviews, it's part of like, you need to have clinical knowledge, you need to know like maximum doses. But in the private setting, you often need to show that you can carry the conversation. Okay. Get involved and start building your ideas and presence. So if something appears very vague to you, for example, you may only know about HIV treatment, but you don't really know about PrEP, or you don't know about the country commitment. So what are the goals that we want to achieve for HIV eradication? You need to get involved and start building your ideas in this area. So, so that you don't have only a very superficial understanding. And LinkedIn is a great platform for this, by the way. You can actually start, you can repost, you can write your own posts, and yeah, build your presence that way. If you're still in KKM, try and seek training in your current institution. So when I was in KKM, I made sure that I took my GCP, because at that time, I thought I wanted to go into clinical research. If you have a CRC, make sure that you also, if you want to learn about biostatistics, sign up for it. Okay. So I've gathered some qualities here that I did not utilize very much in my Ministry of Health days, and I certainly didn't know about any of these. But now looking back, I realized that it's so important in the private setting. So I hope to share this with you. So first and foremost, agility. You're not going to be told from a top-down manner about what to do. For example, Adlisyah had to set up the whole wholesale pharmacy licensing. He had to set up on his own, and he may not have known who to ask. So you need to be agile in the sense of, I need to solve a problem, and there are several ways I can go about it. Empathy and sensitivity, this applies when you want to work with like a community, or you want to work with a vulnerable population. You need to be able to be sensitive to their issues, and you need to also be aware of what are the certain human rights issues that affect their health. And in the pharmacy, we don't really have the time to do that. We kind of just treat every patient according to their age, or maybe according to their health literacy level. But this is another level. And it's really important to take ownership of your work and your growth. So again, no one is going to tell you, here's the SOP, this is what you need to do, your file manager is here. You need to figure out things on your own. Sometimes you're the first pharmacist in the organization. And so you need to think about, what can I contribute? Like, how can I bring my previous skills to achieve the goals of this organization? Communication, both written and oral, is very important. You will communicate a lot by email. You will have meetings where you may need to conduct discussions and debates that you may need to moderate. So this is something that develops a long time. I'm still not very good at communication, but the more you practice, the better you'll get. So grab any opportunity that you can get to, if someone asks you, do you want to host this webinar? Do you want to, write this report? Just say yes, even though you don't think that you're ready for it. Creativity and critical thinking, something that we don't use very much in the pharmacy setting. In the private sector, you really need to be creative about how you handle situations. You need to have some contingency plans if it does not go according to plan A. And you need to think critically about what you're trying to achieve as well. The last two, project management and stakeholder management, it sounds very complicated, but I must confess that I didn't have any of these skills when I first started out. But looking back, I think this is something that is worth emphasizing to the interviewer, because a lot of your work may be project-based. It will not be like every day you're going to see like 500 patients in pharmacy and you know what to do automatically once you enter the pharmacy. But projects will differ. Projects will have different lengths of time. They'll have different complexities. And managing stakeholders is very important. So you need to know who's who. You need to know who is, for example, who is in charge of HIV prevention, or who is in charge of setting the policy for that. So that is within your job scope. You really need to know who you need to network with, and you need to know whose opinion really matters, and read their updates. For example, on Twitter, on LinkedIn, you need to be updated with that. So I would just like to conclude with actionable next step. What can you do today? At the end of our sharing, at the end of this whole webinar series, what are your most immediate possibilities? And I echo what Adlisyah has said. Whether you want to be involved in, whether it is industrial pharmacy or whether it is health policy or even none of those, get involved in something, whether it is voluntary or an internship. And by helping someone, so if you find something in which help is needed and you're able to offer that help, you can make a real life impact and you can use that in your future interviews. So I was involved in so-and-so project as the so-and-so coordinator, and this is what I did. So you also get insights from the ground, from people who have seen much more than you have. Your perspective will be much more mature than someone who has just read journal articles about the issue. Look for problem-solving opportunities, because I think being involved in health policy is all about responding to challenges. So you are problem-solving all the time. So if this is your cup of tea, you may need to find these opportunities for yourself. And the third one, this is quite interesting and also very important, which is to find connections outside of pharmacy and maybe even outside of healthcare. In our daily work in KKM, we deal the most with our colleagues, with our staff. And that's fine because we're performing a very specific function in the hospital. But in health general, in the big picture of health, health professionals are not the only one who are solving this issue. So you need to work with social workers, you need to work with patients themselves, you need to work with advocates. So try to seek these connections early, and you don't have to wait until you've gotten a job position to do this. And my last 3 points: seek a mentor. If you see someone who is maybe they're a few steps ahead of you in the career ladder, try and engage them, and try and you can send them a message on LinkedIn. Try and start a conversation. Following your curiosity means, yes, as Adlisyah said, maybe not accept every single term and condition. So follow what you think you can contribute in the best manner. And all of this requires a lot of self-reflection. So again, this is not something that I did back at the start. This is something that I realized along the way that would hopefully help you to find that next career step. So that is my sharing for now. And I really like to hear your thoughts and your discussion. I think that's quite important. I'll pass it back to our moderator, Jian.
Thanks for sharing, Winnie. I think from the sharing, just to understand briefly on what you do, just to have a glance of what you did as a research officer at Galen Center. But I think, of course, for our participants, it's mostly constitutes of either students or maybe those who are still in their contract. So would you mind sharing a little bit more on what you do, maybe on a daily basis or on a project basis as a research officer with the Galen Center? So to give them more insights.
Yeah, so I think there are various positions. There could be research officer positions, there could be project officer positions. What I do is I actually I get involved in conversations and meetings that we organize on a certain health issue, and I basically produce like a report or maybe a policy paper that results from this consultation. And this is basically part of policy. So you have conversations, you have a lot of policy documents that are published, and then it's always a constant negotiation with people who set policies, for example, like government, the private sector, and NGOs. So I don't want to go very much into what I do, but I think that there's a lot of transferable skills that you can kind of take from my presentation to use in kind of any private sector job. Yeah, if that answers your question, Jian.
Yeah, definitely. Thanks a lot, Winnie. I think some of us would be, interested to understand more on the career itself as well, because I think we are not sure if there's a definite pathway on how we can actually progress, let's say, from a recent graduate to a research officer or part of the Galen Center team. So would you mind sharing, how did you transition from someone who worked in KTM and eventually to the Galen Center as a research officer? How was the transition like?
Yeah, so it wasn't very, like I said, I didn't know anything about health policy. I just had an idea that I wanted to work in a field that's outside of pharmacy. So I came across the post on Facebook because I was already following Galen Center at that time. So I think this is what I meant by making sure that you follow certain organizations or certain individuals in order to see the opportunity. So that's how I found the job posting. But also, how did I transition? I think I was really quite uncertain because I didn't know anyone who was a research officer. I didn't know. Certainly, I was the first one at the Galen Center. But after me, there were actually medical graduates who came in as well. So some doctors also work here. I think it was like holding on to that value of what I wanted to achieve, because I knew that this was a stepping stone. I knew that I wanted to go further than this. And so I knew that I didn't want to stay in this particular organization for life. I knew that it had certain, it offered me a certain value, and I was keen to explore what that was.
Right. So I think for those who are interested, maybe they have to keep up to sort of follow the source of the information actively to sort of discover if there's any form of opportunities with these centers or institutions that are interested in that. Okay.
So health policy, yes, and I think health and social policy, they are often driven by think tanks. So you can find the think tanks that are based in Malaysia. There are many, and some of them are quite small. So you may have to find them on Facebook or find them, maybe just go for a webinar and see who's there, like who's on the panel. So someone has already made the selection for you that these are panelists who are worth listening to, and that may be how you get to know a particular startup or a particular think tank.
Thank you for your sharing. I think it will be helpful for those who are interested. So we actually have two more questions from the floor. Allow me to read them out to you. Okay, so the very first one goes, for someone who has graduated 3 years ago, I am just starting my PRP. So I have forgotten most of my clinical knowledge, and I'm quite nervous to be starting my PRP, as this is something that I have somewhat lost touch with. So do you have any advice on how can I cope with it mentally, besides reading back on old books? Do you mind answering that? Yeah.
I'll give Adlisyah an opportunity to answer this first, and then I'll add on.
Sure. Adlisyah?
Well, Winnie. Okay. Well, because it is something that I didn't go through. So
okay. Let me start first. Sorry.
Ah.
I think you can. So I volunteer at Clinic Amal Muhajir, and we have a pharmacy, and we have pharmacy volunteers. We also have pharmacy students who come in and help as well. So if you are worried about how do I connect, like, this gap between my clinical studying days and I'm going to start practicing as a PRP, you can consider volunteering. I mean, I'm happy to let you know the details of how you might want to volunteer. But this is one avenue. So you start volunteering in a pharmacy, perhaps that's run for an NGO clinic, and you serve patients, you dispense, you see their processes and procedures. And I can guarantee you that when you start PRP, yes, it'll be more intense in the hospital, but you already have some basics of how do you check for medication error? How do you check that this patient understands what I'm saying? How do I distinguish like two very similar medication names? What are the medication groups that are relevant to most of my patient populations? So that could be a possible avenue for you to consider. And if you like to volunteer for the clinic, just drop me your email maybe, and I'll be happy to link you up. We do need volunteers right now. Adlisyah, anything to add?
Yeah, regarding that questions, I think for myself, like when I started my PRP, I didn't really open my old books also but along the way, when you are doing your training, like where you are in a specific department in hospital or clinics, then you might need to update yourself regarding all the medications, and then sometimes you need to also basically learn something from whatever you did in specific department. So it doesn't really need you to be actually reading any books or journals or anything. But for someone who actually left degree like 3 years ago, I think I cannot really answer that. But like along the way when you are doing a PRP in the government sector, I think you can just update yourself during your PRP training. It's not something that actually can put yourself down, for my opinion.
Yes, we all start from struggling to dispense amlodipine 5 mg OD because we're like, oh my God, this is so intimidating. And then at the end of PRP, you're like, here you go, nephrology patient, 13 medications.
Yeah.
Thank you so much for your response to the questions of Winnie and Adlisyah. So we have one question addressed to Winnie. So it's actually quite similar, two questions, so I'll just combine them into one. The first question is on what are the other than pharmacoeconomic subject, what do we have any subjects that have to do with research policy? And another one is on how can the policy generated in your worksite be applicable in private setting, or can it also be applied in the government setting?
Those are great questions. And I must say that is something that I'm still thinking about. In terms of what are the subjects that you need to understand policy, research, policy, health policy, pharmacoeconomics is one aspect of it. So that is the financing part. How do you finance medications for the health system? There are so many other aspects of that. So I would say the basics is you should know about health systems in general. So you should know what are the building blocks of a health system, because in a pharmacy, sometimes we don't see these things because we're so focused, we're so specialized, and we don't realize that, for example, the role that NGOs play in supporting our patients. We think that if we provide them with the medication, they go home, they do all right. But actually, this health policy framework, it relies a lot on collaboration. It relies a lot on understanding public health. And so if you're interested, there are courses such as public policy programs. If you study public health, I think they also teach health policy. But no, it's not restricted to pharma economics solely. So even things like governance, even implementation science. I mean, these are very big words, but what I'm trying to say is that everything that we provide is within a policy framework. And so even if you're working from NGO point of view, if you're working from a science point of view, you can think about COVID vaccines as an example. This is a very good example. We have scientists who develop the medications. We have regulatory pharmacists who approve the medications, but we also have NGOs that bring people who cannot get vaccinated to the centers, or we have mobile outreach teams. And then we have volunteers who run these centers. We also have ministers who make sure that we can pay for these medications. We have Gavi, which is an international body that makes sure that we have a COVAX scheme so poor countries don't miss out so much. So it's actually very accessible. And but you should definitely find which aspect that you're interested in. So if you like financing, if you want to think about questions like financing, then yes, health economics, farm economics is the way for you to go. The second question about policy. So policy is not really like divided into private and public. It's more of like, how can we work together? So if you have a national policy, for example, to reduce NCDs, to reduce diabetes in the country, you need to involve a private sector as well as the government. So you can't just let government to do all the work alone. To treat patients, to screen patients, you ideally want to involve as many people as possible. So you can read up on health in all policies. That is something that's quite interesting, which is every policy that we have, we should think about health outcomes and the health impact. So yeah, I think that is my answer for now, but it's a very, very good question.
Thank you once again, Winnie, for your response to the questions. I think due to the interest of time, even though we still have a few more questions to go, we may have to end it here. So we will have Winnie and Alicia's support to respond to this question, and if possible, we'll share them with everyone after the session. So with that, thank you very much both Winnie and Alicia for your sharings and your response to the Q&A sessions. So this pretty much sums up our Q&A sessions as well as the speaker's presentation. So before we end the session, we just want to take this opportunity to express our gratitude to both of our speakers, Winnie and Alicia, as well as our participants for taking your time to join us in our session. We hope that the delivery will be helpful to you. So just before we end our session, could we just invite everyone to take a group photo with us? So our committee members will be making everyone a panelist.